Good afternoon. Thank you for coming out today. Today I'm being joined by Baltimore County's Health Officer, Dr. Gregory Branch. We came here today because over the last week or so, it has become clear that across our country, throughout Maryland and here in Baltimore County, our COVID-19 numbers are no longer trending in the right direction. Maryland recorded more than 900 new cases on Sunday, the most in a single day in nearly 2 months. Here in Baltimore County on July 18th, we saw 206 new cases, the most we've seen since late May. Cases are skyrocketing among young adults. Our largest case counts in Baltimore County are now among individuals in their 20s, 30s, and 40s. Unfortunately, we know that significant increases in cases are often the precursor to increased numbers of hospitalizations and deaths. If we fail to take action, we know these numbers may also soon begin to rise. Making matters worse, here in Maryland, like other parts of the country, we are seeing a delay in the time between when a test is conducted and when results are received. This practical effect means that our knowledge of the reality on the ground is often actually days behind the truth. Over the course of this pandemic, we've put significant infrastructure in place to help us face this crisis. Our testing capacity has grown exponentially, and we're now testing thousands of residents per day. We've stood up an extensive contact tracing operation with dozens of contact tracers in place and even more still in the pipeline. We've acquired large amounts of PPE to keep our employees safe and to support our nursing homes and other long-term care facilities in their efforts to combat this virus and save lives. We continue to provide groceries and meals to help our residents who have lost their jobs and income as a result of this pandemic. Baltimore County government, in collaboration with the Baltimore County Public Schools, together have distributed over 4 million individual meals, and we will continue to address food insecurity as long as this crisis continues. We've made available millions of dollars through grant programs to support our small businesses, including our newest grant program announced last week to reimburse business owners for money spent on infrastructure improvements to protect the health of employees and their customers. And we're actively exploring ways to support working parents whose children will be remote learning this fall. But if we want to keep businesses open, if we want to get our kids back in the classroom this fall, if we want to begin to feel anything like normal again, we have to stop the spread of this virus within our communities. And it's clear that here in Maryland, despite our best efforts to date, we are still not doing enough. So today we're taking the next steps to help keep Baltimore County residents safe and healthy. Effective Thursday at 9 a.m., Baltimore County is issuing a public health order to require all individuals aged 2 or older to wear masks in any indoor public space. The evidence here is indisputable. Masks help reduce the spread of COVID-19. The CDC is now calling face coverings a critical tool and one of the most powerful weapons we have in the fight against COVID-19. But we know that this tool is most powerful when used universally within our community settings. It's regrettable that for some, mask wearing has become politicized because this isn't about politics. It's about public health. It's about saving lives. Still, I'm encouraged that nearly half of all U.S. states have broad statewide mask mandates. I hope that Maryland joins these ranks soon, but in the meantime, this is a step that we should and must take here in Baltimore County. We all need to do our part, particularly when we are indoors. We need to be covering our faces. Under Governor Hogan's previous orders, masks are already required in food service and retail establishments. Our new order makes it clear that people are also required to wear them in recreational facilities, houses of worship, and other spaces open to the public. While the order does not mandate outdoor mask wearing today, it does strongly encourage residents to wear masks whenever social distancing is not possible. If you're hiking or on a trail, walking in your neighborhood, or picnicking at a county park, you should have your mask with you. and you should put it on if there are other people nearby. This is a small step we can all take to protect ourselves, our neighbors, and our loved ones. And it's a sign of respect. It tells other people that we worship alongside or share an aisle with in the supermarket that we respect them as a fellow human. Now, there is one activity this new order does not address: indoor dining. By its very nature, indoor dining and drinking is an activity where masks can't help prevent the spread of COVID-19. And as I've mentioned, masks are one of the best tools we have to prevent the virus's spread, to keep businesses going, and to have any hope for returning to school this fall and returning to any sense of normalcy. Indoor dining and bars, unfortunately, create perfect spaces for COVID-19 to spread. Individuals are unmasked and eating in enclosed spaces, many of which have poor ventilation. The individuals who work in these retail establishments are inherently at risk, and as a result, so too are their patrons. Now, in Baltimore County, we chose to follow the state's lead when Governor Hogan decided to allow indoor dining. And we did this for a couple of reasons. First, we do not want to confuse our residents and businesses about what is allowed. Second, I have no desire to put Baltimore County small businesses at a competitive disadvantage when so many establishments in neighboring jurisdictions are just a short drive away. And third, the public health benefit to closing indoor dining in just Baltimore County is limited so long as neighboring jurisdictions remain open. If a resident cannot eat indoors here, they will very likely travel somewhere else to do so. The governor often refers to local flexibility in his recovery plan. But the truth is, for local governments, even though it might be flexible, it's also uneven and it's ineffective. A few weeks ago, public health experts, including one of Governor Hogan's top consultants on the state's COVID-19 response, spoke out about the governor's decision to allow these establishments to open. The numbers we're seeing now increasingly make it clear that these fears may well have been justified. The public health evidence and the current state of this pandemic make it clear that indoor dining is not currently safe. So I'm here to amplify what has already been said by the health officers of the state's 6 largest jurisdictions. Governor Hogan should limit establishments to outdoor dining, takeout, and delivery. This is a public health imperative. I would also like to use this opportunity to, yet again, publicly invite the governor to personally return to conversations with the county executives of this state. These are conversations from which Governor Hogan has been absent for over 2 months. We need to hear directly from the governor on what he is thinking. We need to be able to share with him what we are seeing on the ground locally, and together we should develop an ongoing, coordinated response. Governor, let's use this opportunity to restart our joint discussions and develop a thoughtful plan to move forward and combat the challenges in front of us together. It's hard to believe, but we're only 5 months into this crisis, with many more still yet to go. It's a crisis that has affected every person in every community around the world. We have the knowledge and the tools necessary to address it, but we also need the will to do so. We still have a long road ahead. We have to be in this fight together, and we have to work together to defeat this deadly virus. Baltimore County residents, let's continue to stand together as we weather this storm. We can and we will get through this together. At this time, I'll turn things over to our health officer, Dr. Gregory Branch, for a few comments before questions.
Thank you, Mr. CE, and good afternoon to everyone. As shared by the county executive, the public health order that goes into effect this week is necessary to keep us from losing ground in our fight against the spread of COVID-19. Remember, this is a marathon and not a sprint. And much of this marathon is an uphill battle. There are disturbing COVID-related developments in many states across the country. Baltimore County continues to monitor daily testing confirmed positives, hospitalizations, and deaths. There is a continued increase in COVID positive cases, especially in the younger population. Between July 15th and July 18th, 49% of the COVID positive cases were between the ages of 15 to 34 years old. Our percent positivity rate is increasing. Today it's 5.9%. We cannot afford to be complacent. The best defense is a strong offense. Proactively requiring masks inside all public venues will help to defend against the spread of COVID-19. The actions we take today can dictate what the school year will look like for our children tomorrow. The actions we take today can help determine how quickly we are able to resume various recreational activities tomorrow. The actions we take today can play a huge role in resuming interactions with our family and our friends tomorrow. We need to rethink the way we think about our role mitigating this pandemic. And each of us has a role in helping to decrease the spread. We must avoid large gatherings. We must frequently wash our hands. We must practice social distancing, and we must wear face coverings. The CDC guidance has demonstrated the effectiveness of face coverings of preventing transmission. Therefore, I have issued an order beginning Thursday, July 23rd at 9 a.m. for all Baltimore County residents ages 2 and up to wear face coverings in all public spaces. I strongly encourage all residents to wear face coverings in outdoor spaces whenever 6-foot physical distancing is not possible. These actions make a difference for our loved ones. These actions make a difference for our friends. These actions make a difference for our communities. And these actions make a difference for all Baltimore County. Just because you can does not mean you should. Thank you.
Executive, I know your description of an uneven and ineffective approach in calling on the governor to make it more unified, but isn't it feasible that you could partner with neighboring jurisdictions in the meantime to have a broader approach?
I think that the health officers from those 6 jurisdictions made clear that their preference would be to have this be statewide. I think in the absence of the governor, ignoring the data that's out there, that would be a conversation I think we'd have to have. I've said consistently, I don't think that approach is good for just Baltimore County. In the absence of the state acting, I think we'd have to have that at least as a conversation for regional discussion.
John, if you believe you're right here in the numbers that you're looking at, why not just, like David said, why just not get with the 6 jurisdictions and just do it? Take the lead. Why have the governor do it?
Well, as of today, last time I checked, I can only control what we're doing in Baltimore County, which is why the masks are so important. We don't have a direct say over what happens in our neighboring jurisdictions. The governor does have that say and does have that authority. So it would be much cleaner for our residents to have the governor step up and lead on this. In the absence of that, though, it would require conversations which are ongoing, both with the health officers along with our other executives. And I think that there's a shared sentiment among both the health officers and the executives. We'd prefer the governor to do this, but absent that, we'd have to have a conversation. There's a lot of details to coordinate. Doing that just here requires a lot of work, even on something like a mask order here in the county.
But as far as the indoor dining is concerned, why not just get together with the 6 jurisdictions and do it in absence of the governor? You criticize him for his responsible for it. Why not just take the lead if that's what you and the other jurisdictions are thinking?
Well, that would be preferred to, again, one jurisdiction, but even among those 6, you would still have jurisdictions that would not be doing it in this state. And for Baltimore County, for example, we'd have both potentially and or likely Carroll and Harford County that might not be actively participating in that work. Many of our restaurants are just a drive away here in the county, and so that is preferred. But again, the best approach is still for the governor to lead and have the state take action.
How long are you going to give the governor to make this decision?
Well, this goes back to why it would be helpful if the governor returned to the weekly calls he was having with the county executive so that we could have a sense of what he's thinking directly, to have a sense of whether or not he might act. So I don't want to put artificial timetables in terms of when we'd have to have those conversations, but we're hoping that he sees the number and chooses to act.
Mr. County Executive, in the absence of any state action, weeks, months from now, does there come a time when public health of Baltimore County would have you looking at rolling back phase 2, potentially, if it came down to their health versus economics or a balance of economics of businesses or anything else? I mean, there must be some friction.
Yeah, look, we've consistently said we'll do whatever it takes to maintain the safety and health of our residents. But again, any action that we take, even universal mask wearing, is something that we're doing because we want to keep our businesses open. But something that is an action that would be more effective if it were a statewide requirement. In the same way that any sort of changes to the reopening would be so much more effective if it were done at the state level.
Do you have any evidence of religious organizations of COVID contamination or spread amongst religious gatherings, synagogues, etc.?
I'm not aware of any currently in Maryland, but I know across the country we've seen many significant outbreaks as a result of lack of social distancing, poor ventilation, no mask wearing, and so we're hopeful that as we have our religious institutions open, that religious leaders would want to do all that they can to ensure that their congregants are safe. And again, we know that mask wearing is one of the very few effective tools that exist. CDC guidelines recommend it, and it's what we're implementing here today. So,
Dr. Branch, if you would mind articulating the root cause here, specifically 50% of the cases of people under 35 years old, high community case numbers, positivity rate up. What do you believe is the root cause? Is it gatherings in bars and restaurants mostly?
Well, at this particular time, I couldn't tell you and pinpoint this is definitely what's happening. But we do recognize that if our younger population is out in gatherings, if our younger population are at the bars and they're not socially distancing and they're not wearing their masks, that tells us that that's going to be the start or the nidus of how all of this is going to continue to be transmitted. I think it's extraordinarily important that we recognize we have got to do something early. Once the horse has left the barn and people are dying, at that point we can't do anything with COVID. COVID has no discrimination against any particular person. So therefore, it's best if we see some of these numbers which are ticking up, we need to act now as opposed to waiting to kind of decide on what's going to happen later. Okay.
Dr. Branch, is it reasonable for the health department to be responsible for each bar and whether people are wearing masks? From what I ascertain, the state is saying it's up to the jurisdiction, your health department, to be making sure each individual establishment is acting correctly.
Right. So what we do is we educate as a jurisdiction all those different types of facilities. And we have a wonderful social distancing team. That's not only the health department, there are other different agencies within Baltimore County that assist us with that. One of the things that's important is the fact that obviously you can tell some people to do certain things. However, I want to stress, just because you can go out, does that mean that you should?
Thanks, everybody.
Okay, thank you.